Hello everyone from Digaí podcast and BRM podcast. I'm here at Nushama, right?
Yeah.
With Jay and Steven. Thank you very much guys for your time. It's a pleasure to be here. So Jay and Steven, what is this place? What is Nushama?
Well, I'll give my take as one of the founders on the business side.
Okay.
I'll let Steven.
So you're the entrepreneur. You're more,
Yes,
I know that everyone is the entrepreneur, but you're more the businessman that started the thing, right?
Correct.
Okay.
So, I came to this as one of the three founders because of my deep healing experience with psychedelic medicine.
All right.
And after, doing a lot of work on myself and recognizing that post-COVID, the world was really in need of a new type of healing.
Okay.
And psychedelics were an important tool in that new generation of healing. The problem was there wasn't a great legal avenue other than ketamine. And so when we started Nushama in kind of late 2021, beginning of 2022.
Oh, so it's a pretty new company.
Yeah, it's very new. We wanted to take some of the shamanistic and almost ceremonial rituals of certain ceremonial types of psychedelics, but marry it with kind of medical oversight and safety.
So you were a patient before, is that right? And then you said, "Oh, that's the same thing as Frank, my partner. He had the same path, if I can tell you so." And Mr. Steven, you are the medical doctor.
Chief medical officer, medical director here.
Okay.
So I deal with the medical end of things here.
Okay.
Creating the protocols and maintaining safety.
All right. And how did you discover this world?
Through my own experiences with psychedelics.
Okay.
My partner was having some medical issues, chronic headaches and whatnot, and we were introduced to this type of work, and in one journey was able to relieve his issues with one journey. With one journey, was shown and envisioned where the issues were coming from.
Okay.
And it resolved. So I saw the power of this. I'm an internist, so I'm a medical doctor. So I do primary care, internal medicine. I've been taking care of people with addiction from HIV to, I worked at Goldman Sachs. I did the primary care program.
All the way, like from
I've
the
done
businessman
I've
to
been
the
through underserved to banking, and people have similar problems, but a lot of medical issues, stem from more of a disconnect from ourselves, from a consciousness level. That when things are not right in our mind, and when we're not in a right place, that translates into issues in the body.
I see.
So I saw that connection, and I felt like this is really true primary care, preventive care.
How long ago was that?
That was about 5 years ago.
Oh, also
five and a half
almost
years ago. Pre-COVID,
yeah.
And then we got it, and I got involved with Jay over COVID. I was still practicing, internal medicine.
Okay.
And I came in here. I was only doing a day or two, and I saw how. When I started working here, I saw how powerful it was and how effective it was, way more than I expected.
That's a word that I
full time. I gave it my practice, and
So. And I love the way that most of the people who have been working with ketamine and psychedelics for therapy use the word powerful. And I've been a patient myself, and I know it's very powerful. It's very healing, in that perspective. So Jay, you have a whole floor in here in this building in Madison Avenue, and I've been through the rooms, like 18 rooms. So how many people come in every day or per month at least here?
Yeah, I mean, it's been we've been very, very lucky based on our location. We're right in the middle of Manhattan.
Right.
And thanks to Steven and his team's care, we have a lot of people who've become, who trust us.
Nice.
And trust us to deliver safe ketamine therapy, and the results are really good. So we have a very busy practice. I mean, there are some months where we treat over 500.
500 in a month.
Yeah.
Oh my God, that's so nice.
So it's been 500 treatments in a month between ketamine and Spravato, which is insurance-covered nasal spray, and it's been very. More so than the numbers of people, it's the stories. I just met a couple who came here today, and just had a 5-minute brief conversation with them about how transformative their very first experience was.
That's nice. They did a couple. They did as couple, or
Well, they came together but did it in
okay,
separate rooms.
okay.
And for me to, every day there's a little bit of a story like
Yeah.
that.
Oh yeah, you're humbled by this work. I mean, every day I'm amazed.
Because every day is a new story, right?
Yeah, I'm more appreciative of it every day I come here.
That's so nice.
Yeah, so it's.
And see, and then because in Brazil, we still have a very I don't know if that's the right word, like strict area to work with.
Mm-hmm.
But here in the U.S., it seems that way more opened. So, what kind of people should or could be a patient of
Right.
CAP, of ketamine
Right.
assisted therapy?
Yeah, so with CAP, we really focus on treatment-resistant mood disorders.
Okay.
So, depression, major depressive disorder, depression, generalized anxiety disorder, PTSD, which is, sort of the underlying thing between all of them.
Yeah.
There are, these are separate diagnoses, but there's a continuum
Okay.
among all of them. So, we treat addiction. Some of our best results are with
Really?
with alcohol.
Really?
All types of forms of addiction, from
Nice.
sex addiction to gambling. We've had people from opiate addiction.
Oh, that's been a problem in Brazil. Gambling, like
Yeah.
those bets, those on cell phones. People are losing a lot of money. That.
Yeah. So no, I think it's some of the best results. And most people, addiction's also tied into those things, so it's fairly in and of itself. So eating disorders, all types
Perfect.
of things like that.
And
yeah.
is there can I say that some people come for performance? And when I say performance, let me put it like this. Let me have me as an example. I know that everyone has his own trauma,
Right.
but I don't think I have any of those medical issues like depression or really anxiety. I know I have a little bit. I'm very fast forward mind, but of course I'm stressed. Nowadays most people are stressed, and I have a lot of things to be working with, little baby, family, and everything.
Right.
And sometimes I feel that when I did the sessions, I felt a better mind performer.
Yeah.
I felt that my mind was performing way better. I'm not talking only about the traumas or things that it's powerful, but I felt I was better professional.
Yeah.
Do people come here after this kind of treatment?
Yeah, I mean, they do call for that. And, I believe in preventive medicine. So I don't think we should be waiting for people to have mental health issues. Because mental health issues are not a disease. It's from not dealing with a lot of our problems early on. So it collects and collects and collects, and eventually people collapse and it becomes an issue. But we shouldn't wait for it, like blood pressure. We don't wait until it's really high. We start treating it early on before it becomes a major problem.
Yeah.
So I do believe in it. Right now we're not, because it's a new drug. We want to, we have enough of, people with significant mental health issues. So right now we're focusing on that. But I think the future of this type of medicine is not to wait until it's a problem. If there are issues, it can be very, very helpful.
Maybe as like a supplement that we take every day because we want to be okay.
I don't think that's a good idea.
No.
Because I like micro.
Not every day. I'm not talking about. Let me clear that.
ketamine.
I'm not saying that. Let's put it as an example.
Yeah.
I take creatine every day in the morning, that,
yeah.
because this is as a prevention for my my health and everything. I was just saying that maybe in the future ketamine will be something not that you're gonna wake up and take every day. Maybe will, but I meant as a prevention for your mental health, because people don't really care about our mental issues, right?
We want to take something like we want to live a more balanced life.
Right,
I think the best biohacking in the world is when we're straight in here, when we're balanced in our mind and our soul, or something deeper. I think that our body will follow suit. All these vitamins, they're great, and I take them sometimes, but I think the most important thing you can do for anti-aging and for longevity is to live a balanced life.
That's nice.
And I think that's where ketamine and psychedelics really come in. They help, it's a recalibration process.
Okay.
It gets us to sort of stop thinking so much, stop living in our intellect and our mind and our worries, and just balance it with a deeper part of ourselves.
That's perfect.
And that's what it is. Yeah.
Well, look, I agree with everything that he says. We've had people come in here who are like the ultimate biohackers, and they've got so much anxiety because they've got 47 supplements that they're taking, and they're worried about optimizing their sleep because their Oura ring says one thing, but
people takes everything for everything nowadays.
Right, and so what if we go back to basics, what makes the human being feel great? To me, that is the absence of worry. It's the feeling of love and community. It's the feeling of purpose. And why psychedelic medicine, inclusive of ketamine, can be so beneficial to the overall well-being of a human is because it really lends itself to that feeling of connectedness, to that feeling of community, to reintroduction to love, or
True.
the introduction to love for a lot of people.
Yeah.
And it really is, they're really heart-opening experiences.
It is.
So, you know, there is no supplement in the world that can make somebody feel gratitude.
That's true.
But a psychedelic journey that's done with the right intention, preparation, and integration, done in the right setting, can fill your heart up with gratitude. And it is the best medicine in the world is gratitude in itself.
That's
And this opens
That's
the
very
gate
nice.
for that.
And I bet that you guys, while I was there for like 10 minutes, and saw all kind of people coming in, from a guy who looks like a wealthy businessman or to a lady that looks like a regular person in terms of wealth. How did you guys break the stigma, or did it had any stigma about inviting people over to treat their minds with psychedelics? Because this in Brazil, this has a huge stigma. For example, you guys know that I'm opening a clinic just like yours, and I try to avoid as the most I can the word psychedelic.
Yeah, and that's a good point,
Yeah.
because the word psychedelic is loaded with decades of stigma. And Stephen could probably answer this a little better than me, but this idea that people come to us because it's psychedelics. No, people come to us because they're looking for healing, and they've tried so many other things.
Right.
They've tried SSRIs, they've tried mood stabilizers, they've tried antipsychotics, they've tried therapy, they've tried everything. And ketamine assisted therapy is starting to come up in the mainstream as a safe and effective root cause therapy.
Nice.
Yeah, it's like, you know what psychedelic means? You know, if you go, it means soul manifesting. That's what it means.
Oh, really?
So it's nothing crazy. I mean, we associate with the '60s and the LSD and all that.
Yeah.
So there's a lot of that, but it's so not like that. It's really about expressing yourself, getting into a deeper part. And I know, people are pretty, I think, spiritual overall, and sort of open to mysticism, more mystical experiences in Brazil. You know, so there's a sense of faith there. And this really feeds.
It's a very religious
into that.
country.
It's a religious country, and to me, this is true. This really aligns with that. It's about getting back into your soul. It's about turning this off a little bit, the ego, the mind, the intellect, and going into a deeper part of ourselves, our true self, our soul.
Yeah.
And that's where the healing comes from. So it is just a sort of a little chemical. It's a dimmer switch to the ego, to this me, the selfishness, and opening up to more of a
I had
experience.
that feeling in my last experience.
It's wonderful. So there's nothing crazy about it at all. Taking medications, that no one has problems taking all these antidepressants. All those things do. That's the worst.
You got to
thing,
stick
that
to them.
Blocks the soul. That I mean, there's a place for them.
Sure.
I'm not saying they're all bad, but that is about suppression of symptoms. It's not listening to ourselves.
Yeah.
You know?
And so the best marketing that there is the good results. Like I bet that people just come out, get out of here, say, "Oh my God, this is."
Yeah, that's our best marketing. Is giving people walk out and they're our best. So it's going to take a while to really destigmatize it. You know, to explain. That's one of your biggest jobs in Brazil is to educate people what is a psychedelic and explain to them what it is and what it's not.
Yeah, that's on our business
plan. There's also drugs.
Right now.
Ketamine also has a negative connotation in the party world about addiction. Ketamine is an interesting word because it's incredibly safe. Safety-wise, it's not even an issue. But it's also a different drug based on how it's used and the route of administration. So when you do it in a proper clinical setting through the IV, it's a totally different experience and drug than it is when people use it in a recreational setting, like any drug or anything, or like alcohol.
Yeah. I agree to that. And I know that you guys probably don't have like a number, but if you could say so. What percentage of people do you think that after the whole treatment, because we're not talking only about one session, right? The protocol says at least 6, as we were talking. How well do people get out of here? I mean, I know that's not 100%. I don't know if that exists, but most people they normally, how does it,
I would say like well over 90%.
oh my God.
Walk out of here better. Okay.
That's,
I would say almost nobody walks out of here worse. Okay. There are some people who resist
Of
it. It
course.
doesn't work. You can't. No psychiatric treatment's going to work for everybody. Sometimes there's a disappointment. It didn't work for me. They come in here. I've tried everything, and this is not going to work. You have to also meet it. You have to also help it. You can't come in here. You have to have some hope. You can't just expect the ketamine's going to take away all my problems.
Of course.
Nothing will do
You need
that.
to be into it,
You
right?
have to be into it to some extent. You don't have to understand how it works, but just have a little hope, a little bit. You don't have to know, more than that. But I think over 90%, and I'd say well over 80% have a significant improvement in their moods. And
And normally you do the 6, at least, the 6 session treatment, then you have like a boost, right?
Yeah.
And normally, like, if you get a person like depression, I've heard and I've seen the numbers that normally whoever is into those very strong drugs before doing ketamine, and that they keep with the boosting process, they get rid of that medicine.
Mm-hmm.
Like,
You're talking about
antidepressants.
psychiatric medication.
Yeah.
They
There's a
could.
lot, yeah.
The idea is to get a psychiatrist who will wean people off. It's hard.
It
A lot of
is.
psychiatrists don't want. That's another
I
thing.
know.
Psychiatrists are not looking for a cure. That's what they do. So they don't, like, often I find like some of my patients come in here and they're going to see their psychiatrist, and their psychiatrists are adding drugs as they're going through the ketamine. I'm like, why are you doing that? Just wait. Be patient.
Right.
You have to be patient with this and with everything. So it takes a few of these. It's a
Of
few
course.
process. So yes, the hope is that they don't need those Those medications were never studied or never intended to be used for a long period of time. They were meant to be used for short periods.
They get
of time
addicted to it, right?
You become dependent on it,
Right.
And you just become numb. So,
Is it-
If you, I'm not, again, this is coming from the business side, so.
Okay.
But if you're on a big dose of a benzodiazepine like Xanax, and you just stop it,
Yeah.
you are running a serious medical
dangerous.
risk.
It's dangerous.
You get
Yeah.
you get
Oh
a
my
stroke.
God.
Has to be weaned, so no one should stop their medications
Right.
before they start this,
Okay.
or on their own, and it doesn't interact. So you can be on these medications while you're getting ketamine, unlike some other
Yeah.
medicines that we use, like psychedelic medicines. And you have to do it in a proper and in a way with your psychiatrist.
Shows you how
Yeah.
addictive they are.
Yeah,
It shows
effects
you
are
that,
one of them is terrible.
that if you were to stop, like if you're on a big dose of Xanax and you stop, it goes to show you how much it's messing with your body chemistry.
You
So,
can die from that.
Yeah.
It's
And
one of the most
and
dangerous.
probably that's the main reason why the pharmaceutical industry is against or
Yeah.
fights against what you guys doing and
Yeah.
what you're gonna do, right?
They're not looking- it's-
they don't want root cause therapy.
Yeah, of course they don't
Well,
want.
no one wants cures.
Yeah.
Like chronically ill.
Frank, our partner, likes to say that when you do the ketamine therapy, it's like you go in the root of your problems,
Correct.
Mhm.
right? You go
Yeah.
you go deep to see
Right.
what's
Yeah.
the reason of why you're anxious or why you're
Yeah.
depressed, right? And my last question to you guys is, how well the two of you feel running a company that obviously make money? Of course, you gotta make money. It's moral to
Right.
make money,
Yeah.
but you make money helping people treat some things that are horrible and very hard to treat. How well do you feel?
This is very rewarding. I mean, I come to work every day and I feel like I'm doing something. It's humbling and it's one of the most rewarding and purposeful things I've ever done. It's real medicine.
Nice.
I feel like I'm practicing real medicine now.
That's nice.
Right. And look, I'm a big personal proponent of this, and the fact that I get to play a business guy in it is.
He likes to integrate too.
Okay.
Yeah. The fact that I get to see the stories and hear the stories every single day, it's it's exceptionally fulfilling work, and it's the ultimate gift to see people go through their transformations.
However revolutionary do you think it's gonna be, or it is already?
It is already.
It is already.
I think it's very powerful. And I don't even know if you'll need this other thing. There's MDMA coming and psilocybin.
Yeah.
We'll see. I'm not sure you're going to get much more. Like ketamine is very, very safe, and those are safe too, to some extent. But they're easy to work. This is easy to work with. All those, the other psychedelics, you have to come off of your antidepressants to go on them.
Yeah.
MDMA and psilocybin.
World might not be ready for
And
that.
the world might, and it's a long treat. It could be a 5-hour treatment period. plus on either end, so it can be like up
Yeah.
to 8 hours.
Okay.
Where this is
okay.
very quick and very easy, and you can
So
stop
it's
it.
safe,
It's
it's
safe.
fast, it's
Yeah,
efficient.
it's efficient.
It's being tried all over.
We have
You
studies. We
guys
published a
had
study
you
on
had
it.
like over 12,000, 13,000
yeah, over
and-
12,000. Yeah.
safe.
Yeah.
Oh my
exceptionally
God.
safe.
Yeah.
Well, guys, I'm just gonna ask you guys if you have any message to Brazil, to
Yeah, don't
whoever's
be
listening.
scared, Brazil. it's the most beautiful. You guys are naturally spiritual people, which is
We are.
beautiful. We're less so here, and I think this will really align. And it doesn't move. It's not meant to have a spiritual experience. It's meant to get out of our ego so we can live a more spiritual life, a truly spiritual life, and that's the real healing. That's the medicine. So don't be scared of psychedelics. It's not going to make.
Yeah.
It's not addictive. I assure you. It's not
I was afraid, and I'm not afraid
It's
anymore.
not-
It's great.
Yeah, and it's understand to be a little bit scared of it.
Yeah.
But to know that this is true medicine, it's valid medicine, and I've been humbled by it, and I had my doubts too. But I can assure you that
Cool.
it's going to be very good for your people. and
I
your
like how you keep
yeah.
saying it's medicine because it is.
It is. Nice.
Yeah,
It is
it's
medicine.
a medicine. It's a
Yeah.
medicine. The experience is a medicine, and it's not just the ketamine. It's the environment you do it in. You
Right.
have to feel safe. So it's
True.
the set and setting,
True.
the music,
Perfect.
the everything around it is part,
It's part
of
of
that
it.
medicine.
Yeah.
Your belief,
Yeah,
in
true.
it. So yeah.
Okay, guys,
Great.
appreciate it. Thank you very
Thank
much.
you.
Congratulations for the
Thank
work
you.
you've been doing.
Thank you.
Okay,
Thank you. Yeah.
everyone, thank you very much for one more episode. See you soon. Bye.